All right, so let's go on to the cardiovascular system. So let's start with the heart. So the heart is located in your thoracic cavity. And if you remember your different cavities, so it's specifically within the mediastinum. So what does the heart do? Well, it actually keeps your blood that's oxygen poor separate from the blood that's oxygen rich. And we'll see that in some different pictures. Also keeps your blood flowing in one direction. Okay, you don't want your blood going backwards. You want to keep going all in the same direction.
Did you say RD?
Hmm?
Did you say RD?
No.
Okay.
What was it? When did you hear it? So I make sure that I'm not sure what I said. It might sound like RD. Yeah, it keeps the oxygen poor blood on one side of your heart and your oxygen rich blood on the other side. Keeps your blood flowing in one direction, doesn't go back. You're not supposed to anyway. So it's going to create blood pressure. Okay, the force of those contractions. Regulates your blood supply. And as we'll see later, also has an endocrine function. It's going to secrete a hormone. All right. So here's a kind of an overview of your cardiovascular system. So in the center, you've got your heart. So if we start here, taking blood that's deoxygenated to the lungs, exchanging oxygen for carbon dioxide. So you're picking up oxygen, getting rid of carbon dioxide. Blood's going to go back to the heart on the patient's left side, and then get pumped to the upper portion of the body and the lower portion of the body. Okay. And blood's going to return back to the heart via these veins, go to the right side of the heart. So it's keeping oxygenated and deoxygenated blood separate. All right. So how does your heart work in terms of its wall and its coverings? So remember, endo is inside, so endocardium is the inside layer of your heart. You have simple squamous epithelium there, one layer of flat cells. Myocardium is going to be your thickest layer in your heart wall. Remember, myo has to do with muscle, cardium has to do with the heart. So as you can tell, it's made up of cardiac muscle tissue. So then you've got the pericardium. There's two layers. There's a serous membrane. It's enclosing your heart. So you've got a visceral pericardium, also known as the epicardium. And it forms your outer surface of your heart. You also have pericardial fluid. It's released by the epicardium as well as the parietal pericardium. And its function is to reduce friction in your heartbeats. So what do these coverings of the heart do for you? Like, why are they so important? They obviously provide some level of protection for your heart. Keep your heart in a certain location. Also, they keep your heart from overfilling. Okay, you want it to fill with blood, but you don't want it to fill with too much. Okay, so having those coverings provides a layer of resistance to know when it's full. Okay. So if you think about if your heart, if the chambers of your heart were like a balloon, it would just stretch and stretch and stretch and stretch. And at some point it would just burst, right? But you need to have some resistance to be able to say, no, this is how much I can take. That's it. So what are some of the different chambers in your heart? Got your right atrium. You're going to get oxygen for blood there. So blood vessels like the superior and inferior vena cava, as well as the coronary sinus, they're going to empty their blood straight into the right atrium. Now that venous blood is going to go from the right atrium through what we call an atrioventricular valve, because it's between the atrium and the ventricle, or AV valve, also known as a tricuspid valve because it has 3 cusps, down to the right ventricle. Okay, so this helps to direct your blood flow, keep blood from flowing backward. Now in your right ventricle, you have these structures called chordae tendineae. And they're basically cords that look like tendons. And they're connected to the tricuspid valve. They're also connected to the papillary muscles in that right ventricle. And those also help to maintain blood flow in a certain direction. Now, as blood leaves the right ventricle, it's going to go through what we call the pulmonary semilunar valve. Okay, because again, this is deoxygenated blood. It's going to go into the pulmonary trunk. Pulmonary means lung. Okay, so a pulmonologist is a physician who studies the lungs. Now, on the left side of the heart, you have oxygen-rich blood, and it's coming into the heart through the left atrium. Okay. That blood gets there from the pulmonary veins. You have 2 on each side of the body. So you have a total of 4 pulmonary veins. Now that blood's going to go from the left atrium to the left ventricle through the, essentially the left AV valve, or left atrioventricular valve, also known as the bicuspid valve or the mitral valve. Your left ventricle forms that apex of the V shape of your heart. Okay. Now, where does blood go from the left ventricle? Well, it's going to go through the aortic semilunar valve. It's aortic is going to go into the aorta. And this is semilunar because the valves look like half moons. Okay. All right, so here's a photo. So here's your, this is the patient's left side, this is the patient's right side. So here's the right atrium. Okay, so blood's coming in from the inferior and superior vena cava, going through the right AV valve. Okay, so here are cusps of the valve and the chordae tendineae and the papillary muscles. Blood's going to flow. Now, when the ventricles contract, blood will push out, that these valves will close. They only open one way. these valves will open. The pulmonary semilunar valve go into the pulmonary trunk, and now go to the lungs, to the pulmonary arteries, left and right. You'll get oxygen there. It'll return to the blood via the pulmonary veins, going to the left atrium. Go through the left AV valve into the left ventricle. You can see it has lots of muscle. Okay, it forms the apex of your heart. Okay, blood's then going to go through the aortic semilunar valve into the aorta. Okay. The aorta has some branches, which we'll learn about. You have your brachiocephalic, common carotid artery, subclavian artery.
Did you see that blood flow on the X-ray or something?
Well, on an X-ray, because X-ray is going to be like a static picture. So if you're looking at more of a digital X-ray, yes, you should be able to see that. On a digital sonogram, yeah, you can kind of see a little bit of blood flow. So this is a microscope picture. So if you think back on the cellular level, here are the cardiac muscle cells, right? It should look like a sarcomere kind of to you. Here's the mitochondrion. Also, as we'll learn more about cardiac muscle, remember it has intercalated discs. They connect the cardiac muscle cells, allow them to communicate with each other and have a coordinated contraction. Okay. All right, so before we go on to the valves a little more, I'd like to pause and let you all discuss the path of blood flow through the heart and the different structures that blood goes through. You can do this at home as well. Okay, let's talk about the heart valves a little more. So you have the AV valves and the semilunar valves. So the atrioventricular valves are normally going to be open. When the ventricle contracts, it shuts down the AV valves because the blood's already come through there, right? And your papillary muscles will contract, and that keeps the valve from sending blood back into the atrium. Okay. All right, with the semilunar valves, they're actually normally closed. And what forces them open is when the ventricles contract. Okay. All right, so if you've ever been to the doctor and they put the stethoscope on your chest to listen to your heart, okay, or if you've done it in class, you've kind of probably heard the lugged up sound. So the lug is the first sound you hear. Okay, so you hear that when the ventricles just start contracting. So you're hearing the AV valves close, and it's typically longer than the second sound, low pitch. The duct is when those ventricles relax and those semilunar valves start closing. When they close, you hear the duct. Okay, so medical implication here, person that has heart murmurs, or if you have a pet that has heart murmurs, this is due to valves that are leaky. And that's because they're not closing properly. And blood's going to flow back into the atria or flow back into the ventricles, depending on where, which valve is leaking. So if the AV valves are leaky, blood would flow back into the atria. If the semilunar valves are leaky, blood would flow back into the ventricle. Okay. that in either case, you're not getting full blood flow, right? Which means your heart and your body are having to work harder because your body's not getting all the oxygen. Now, we sort of separate the vessels of the heart into different circulatory systems in general. You have the circulatory system, then we have different types of circulation. So one of them is the coronary circulation. So the heart cells actually don't get their nourishment from the blood that's in the chambers of the heart. Okay, so your left and right coronary arteries are branches off of your aorta. So that means they're still able to get oxygenated blood. They have numerous branches. So your heart actually has many small blood vessels on it, okay, to make sure it has the nutrition and oxygen supply that it needs to continue to beat and contract. Now, after blood passes through cardiac capillaries or coronary capillaries, it enters cardiac veins. And these cardiac veins enter a structure we call the coronary sinus, and then that coronary sinus feeds into the right atrium. So you're still able to get blood to the heart and then back to the heart. All right. So here's the blue tells you your great cardiac vein. And here's your left anterior descending coronary artery. So you can see here these arteries and veins supplying your actual cardiac muscle tissue of your heart. Okay. And we've already covered most of this, but just remember this curvature or point here, that's your apex of your heart. All right, so go ahead and talk about the heart sounds and the coronary circulation. I'll give you a minute to talk about that. You can do that at home as well. Okay, so the heart's able to contract in a coordinated way because it has a conduction system that's able to essentially use electrical signals to make a coordinated heartbeat. So you're going to have initiation and stimulation of the atria and the ventricles. It's intrinsic, so you don't need the nervous system to make your heart beat. Okay. And you get a coordinated contraction of your atria and your ventricles. So you get nodal tissue. Nodal tissue has both nervous and muscular characteristics. So you have the SA node or sinoatrial node, and it's in the upper posterior wall in your right atrium. So posterior is toward the back of the body. So it's toward the top of the heart, but toward the back, toward the right atrium. And it's initiating the heartbeat, it's getting started. So about every 0.85 seconds, you're going to send out an excitation impulse. And it serves as your heart's pacemaker. Okay. You also have an atrioventricular or AV node at the base of your right atrium. And the impulse here is going to be delayed, but it signals your ventricles start contracting. Okay, now you've also got an atrioventricular bundle that's basically getting a signal from the AV node. You also have Purkinje fibers, and we'll see where all those are. So you're in the upper posterior portion of the right atrium is your SA node. Here's your AV node, between the atria and the ventricles. This is your AV bundle. Okay? It's a bundle of nerve fibers. And they go essentially around the apex of the heart. Okay, and these little branches off of the AV bundle are the Purkinje fibers. So you're getting a coordinated beat or heartbeat from your atria and around to your ventricles. Okay. So if your SA node stops working, because that's the initiator of the heartbeat, you don't get a coordinated contraction. And so that's why people need to get artificial pacemakers put in. Now, if the person's heartbeat is slow because the AV node is damaged, we call that heart block. Now, if you get other tissue other than your SA node becoming your pacemaker in your body or in your heart, you can get an extra beat, okay, because you're getting another signal. And call that ectopic pacemaker. Okay. So like an ectopic pregnancy is basically a pregnancy not in the normal place, and we'll get into that when we talk about reproductive system. An ectopic pacemaker is when you have essentially a heartbeat originating from somewhere it should not. Okay, so electrocardiograms are recording devices that can sense changes in electrolytes inside your myocardium, your heart muscle. And physicians use that to detect causes of irregular heartbeats and provide a diagnosis, say what's causing it. And these irregular heartbeats are known as arrhythmias. So, because you have a rhythm, arrhythmia means rhythm is off. Okay. All right, so let's pause and talk about the conduction system in the heart. All right.
You'll be okay.
So we will pick up on the cardiac cycle next time. What I'd like for you to do now is to do your exit tickets. Okay. All right. And see you in the next video.